Hello everyone, welcome to our podcast. Let's talk about emollient therapy for premature infants. Today on our podcast we have Grace, Katie, Violet, Angelina, Bevney, and myself. We also have a special guest, Johana Diaz, who is a junior clinician scientist who works at the University of Maryland Medical Center NICU, where they are currently in the process of conducting a trial regarding infant massages in small premature infants using oils. She will be featured later in the episode. We are going to be discussing a medical intervention regarding emollient therapy in preterm infants and its proven benefits.
Since most of you likely have a limited knowledge of emollient therapy, let's discuss it in a bit more detail. Emollient therapy aims to solve infant mortality by moisturizing the skin and preventing the entrance of irritants, which proves useful in aiding preterm infant development since these babies are more vulnerable to infections due to weakened immune systems and underdeveloped organ systems. Preterm survivors suffer from a range of adverse effects throughout adolescence. In our focal case study, Impact of Emollient Therapy for Preterm Infants in the Neonatal Period on Child Neurodevelopment in Bangladesh by Gary Dramstadt, observes the neurodevelopmental outcomes of infants who received emollient therapy during the first 2 years of adolescence compared to those who didn't. This research consisted of an observational cohort study assessing the impact of emollient therapy on the neurodevelopmental conditions of preterm infants during early childhood. The study selected 497 infants in the special care nursery of Dhaka Sishu Hospital at random who either received topical treatment with sunflower seed oil, Aquaphor, or neither during the first 4 weeks of life. Out of these 497 selected infants, 159 of the surviving children were selected for an additional study monitoring their neurodevelopmental status over a 6-year period. This trial showed that the treatment with sunflower seed oil reduced the risk of developing impaired fine motor skills, and Aquaphor reduced the risk of hearing disability and significantly improved psychomotor development. Emollient therapy is extremely cost-effective, as the cost per death averted in Bangladesh is $61 for sunflower seed oil therapy. This displays how resource and income-limited regions could benefit from incorporating this intervention to further reduce preterm infant mortality.
Different interventions have been implemented according to the needs of specific populations, as certain regions require more cost-effective interventions and others have wealth indexes that allow for more expensive interventions to be easily accessible. For example, the United States has NICUs and screening technology that allows for any possible disorder or health hindrance to be easily identified even in the early stages of pregnancy. Other countries, especially least developed countries such as Bangladesh, have higher rates of infant mortality because they don't have access to high levels of technology or proper neonatal care. In our podcast, we will be asking questions and discussing ideas pertaining to our overarching thesis. Should emollient therapy be used as a long-term treatment for all preterm infants? And specifically look at whether this intervention will be the most sustainable and beneficial in least developed countries such as Bangladesh that require more focused care. Using massage therapy with the use of sunflower seed oil, Aquaphor, and other topicals to reduce sepsis and neonatal mortality in preterm infants who are hospitalized in mostly 33 weeks or less. The case study compared the results of performing the massage therapy with the topical treatment on one group and not performing the massage therapy on the other group.
We believe that emollient therapy will be a long-term health intervention for preterm infants as it is cost-effective and hospitals can have easy access to these topical ointments. Staff and nurses need to be trained and educated on the processes and techniques of emollient therapy. For example, health professions need to be trained in appropriate methods of gentle massages to ensure they are doing it correctly and not harming the infant. Implementing this into every health professional curriculum provides medical providers with this knowledge and educates them on proper techniques. This will allow for the sustainability of this intervention as medical professionals are required to go through their training of emollient therapy and will be properly trained. Emollient therapy can also be sustainably implemented to reduce the use of other medical interventions that have more severe risk factors, since this type of intervention has very low risk factors. This intervention was sustained because there was evidence that showed that emollient therapy benefited the health of the infants. It showed that low-income populations can benefit from the emollient practices and can improve long-term neurodevelopment, neonatal weight gain, and reduced risk for serious infections and mortality. Data proves that the interventions of the massages are now common among newborn, infants, and child practice and throughout many low-income countries. Factors that contribute to the sustainability of emollient therapy include how cost-effective this intervention was compared to other methods of reducing infant and neonatal mortality, such as the NICUs with extensive monitoring and quality neonatal care with screening tests. Since Bangladesh is considered a least developed country, having a less costly method allows for this intervention to be more accessible for all citizens and easily implemented.
In this study, emollient therapy on preterm infants has proven its effectiveness through the outcomes that have come with it. Through the closer analysis of the 6 years of life of the 159 infants who received the emollient therapy, one can see that the risk for developmental problems were low compared to infants who did not receive the therapy. This proves that emollient therapy continues to help preterm infants even after its initial job is done. The emollient therapy's job is to keep an infant's skin moisturized to stop any pathogens from entering their fragile bodies. This type of treatment allows the babies to go home faster, as well as have the parents continue it while at home, making it more effective. Since they have very weak immune systems, it's crucial for them to stay clear of any harmful irritants. However, the study has shown that it does much more than that, with it working beyond infant years and lowers risk of various health problems as the child grows.
In terms of ethics, some rising thoughts we had were if the widespread implementation of Aquaphor massages, a cost-effective method that could be used widely, is more beneficial than limitedly implementing more costly alternatives such as NICUs. With Emollient Therapy being easily accessible, more people will be able to access a form of neonatal care. Whereas care in the NICU units of hospitals leads to fewer people being able to access care. This forms a barrier to getting access to proper care families from different socioeconomic statuses. Morally, this intervention can go against culture of parents of the infants. Parents will have to choose whether the health of the infants is put before their own traditions, values, and cultures. Another moral issue that may arise is if infants are allergic to Aquaphor or sunflower seed oil, and if they are tested for allergies to Aquaphor in the oil before using it. A legal issue could be not obtaining the proper consent from the preterm baby's parents to perform the massage therapy. The nurse not asking the parents of the infant for consent before performing the massage therapy can lead to legal action against the hospital from the parents.
Some benefits of the intervention have clearly been observed in infants. This is a cost-effective intervention for promoting preterm infant health, and it reduces infant mortality rates by reducing infection rates and promoting healthy weight gain. While this treatment reduces invasive infections that may result in infant death, it can help promote weight gain as previously noted and reduce the mortality associated with these two areas. It has little to no effect on overall mortality outside of these two areas, however. So while this intervention can result in improved health, it can only do it to a certain extent. It will eventually reach a point where there is no more proven benefits anymore for the infants. Another drawback is that if this intervention is enough to have a significant improvement in infant mortality, then what can be done in the future to increase the effectiveness of this intervention in reducing infant mortality?
We now welcome our special guest, Dr. Joanna Diaz, a junior clinician scientist and currently an assistant professor of pediatrics in the Division of Neonatology at the University of Maryland Medical Center. Dr. Diaz's research focuses on hypoxic ischemic encephalopathy in newborns, a type of brain injury that can occur before, during, or after labor when the brain experiences a decrease in oxygen or blood flow. Dr. Diaz works at the University of Maryland Medical Center, NICU. They are currently in the process of conducting trials analyzing massages in small preterm infants using topical oils and seeing how these treatments improve infant development. Dr. Diaz, could you furthermore explain your research and some of your experiences and knowledge about emollient therapy for preterm infants?
Hi. Thank you so much for that very kind introduction. And yes, so as Grace just mentioned, I am one of the neonatologists at the University of Maryland, and I'm the lead neonatologist in a multidisciplinary group called Neonatal Neurocritical Care. And our main focus is infants at risk of brain injury, which pretty much could be any infant admitted to the neonatal intensive care unit. And while technology has advanced so much and it has allowed us to rescue smaller and smaller babies, some of the things that we see is that this interventions that we do in the NICU can be quite stressful. In the world, massage therapy has been part of integrative medicine for so many centuries. However, its use in neonatology is being quite limited. For that, we decided to explore the use of infant massage in our most preterm infants. To this day, we couldn't find in the literature any reports of scheduled therapeutic massage to infants less than 32 weeks and the impact that this could have in their growth and length of stay in the hospital. This will be a randomized clinical trial that we are hoping to start this coming July 2023. We, as part of the University of Maryland, the team, a research team, has received neonatal touch massage certification when we are planning at this moment to provide massage by one of our trained and certified clinicians. Our hope is to review the outcomes when it comes to especially growth, postnatal growth of these infants, the length of stay, hoping that they will get to go home faster, and as well as looking at all the associated comorbidities of prematurity.
Thank you so much, Dr. Diaz. Okay, so I wanted to ask the first question. Have there been any positive health outcomes for preterm infants from the trial?
At this moment, we have not enrolled yet. As I said, we are in the process of implementation. We will be enrolling starting in July. However, based on literature, we'll tell you a couple of things. Newborn oil massage is an intervention that has been a traditional practice in many cultures for hundreds of years, particularly in Asian countries, like India, for example. And what they look at is, number one, it amends the mechanical barrier, and it's also a source of essential oil for the babies, which will allow for growth. There is also some data to support that this decreases the risk of infections in the neonatal period, which is something so important when you look at developing countries and the rate of mortality or infant mortality. And most recently, some studies have suggested that there is benefit in brain development. This decreases stress, particularly when you are in the NICU. And again, as I said before, babies get to go home earlier or faster. There are data at this moment to prove that this is true for larger infants. So infants who what we will consider late preterms, who are born after 34 weeks of gestation. But to this day, at least in the United States, there are no studies done in smaller babies, which is what we are intending to do with our study coming this July.
Thank you so much. Okay, and then my second question is, why do you believe sunflower oil and Aquaphor were chosen to be the topical treatments in our specific case study, and which topical treatments will be utilized during your trials?
We actually going to use oils because oils compared to petroleum jelly are best, especially in the first 2 weeks of life, because the infants are lacking their stratum corneum, the most superficial layer. And when we use oil, that allows easily absorbance of fats, and that will help with weight gain. Have we used petroleum jelly like Aquaphor or Vaseline in the NICU before for older infants? Yes. But for our study, because we are going to do this in younger preterm infants, we will be using oils. In the literature, you will see that any oil is Similar in terms of results besides olive oil, any oil does not have an scent. For example, mustard is the most common use, but you can use any natural plant oils like sunflower, sesame, coconut, soybean, and within others.
Thank you so much, Dr. Diaz. Moving on to the next question. How accessible are the treatments for families with preterm infants, and how much awareness do people have of this treatment?
At this moment, our rehabilitation team, which includes physical therapy as well as occupational therapy, assess infants in the NICU. Older infants do receive some type of massage therapy, and usually the families are involved in this and they get taught of how to do this massage using either any type of emollient or petroleum jelly. It is easily accessible, at least within the University of Maryland medical system. And our hope with this trial will be to also educate the families, hoping that our findings are suggesting that we will be able to decrease the length of stay. And if that is the case, we are planning to apply this to any future infants admitted to the NICU.
The next question I have is, can people with access to oils or petroleum jelly do the treatment themselves at home with their infants?
Yes, most of the time, many of the things that we educate the families on, we ask them to continue at home. We see our infants in NICU follow-up clinic, and many of these things are reiterated at that time. And we try to involve as much as possible patients at the bedside. One of the difficulties, at least within the University of Maryland, is the fact that we are a level 4 unit and it is a referral center. So sometimes it's quite difficult to families to be present at the bedside at all time. But we use most of the time they are here to participate in their infant care and as soon as possible, get more comfortable in interventions before they are ready to go home.
And our next question is, do you think this is the most cost-effective type of treatment?
I would like to say yes, but you will have to ask me in a year.
Okay. And then what is the plan for ensuring nurses are properly trained to administer alignment massage therapy?
Any of the changes that we institute in the NICU usually go through a process of education, widespread knowledge within any team member, and particularly the nurses who are the team members that work the most with these infants on a daily basis. We have multiple meetings. We have ways through emails, to charts, to boards, and ideally, for example, with any type of intervention, we'll do in-service trainings for everyone within the NICU that will participate in the study. So all of these are usually implemented before any research is done.
Okay, thank you. And also, I know you explained that the parents or like the family members are usually at the bedside. Is there any other plan to ensure that parents are properly trained to administer like this form of therapy for the infants?
We are lucky that at the university we have a parents-driven committee, and it's usually a forum that allows us to get feedback from what works best for the families, how they feel that the communication is best given to them. So we have usually run smaller group sessions that occurs in our parent conference room. With COVID, things switches so much. So sometimes we also create these videos, handouts that we give to families. And if by any reason we are unable to meet them, many times we leave things at the bedside that is a folder specific just for communication to the parents, and something that we use also in case we need to. But as of now, many of the resources we use to communicate to the families are very useful.
Our final question has to do, this might be looking a bit into the future, but has your team talked about a possible plan to distribute oils and other topical treatments to families, and how this plan of distribution will take into consideration those with allergies, limited access to healthcare, or other restricting factors?
So at this moment, the study, for example, will only include a massage therapy done by certified providers. But in the future, we hope that with the findings of this study, we could replicate this by a family, either mom, dad, whoever it is at the bedside. And that is our hope for the future, if we are able to prove that infant massage in this population can decrease the length of stay and improve growth. When we talked about allergies, allergies, particularly to food, is something that we don't see often in the NICU. These babies are truly not fed other than to breast milk, and we haven't seen any allergies to, or at least reported in the literature, skin allergies or reactions to these type of oils. But thank you. That will be something that we will take into account if there were to any allergies or side effects to present.
Okay, so this concludes our interview portion of the podcast. Thank you so much, Dr. Diaz, for taking the time to share your experiences with us today. Your perspective on emollient therapy has been really valuable. Your answers were incredibly insightful and provided our listeners with crucial information for the future, and we've gained a lot of information today, and we're excited for the future of emollient therapy and the increasing benefits for preterm infants that it will have. Thank you so much for taking the time to participate in this discussion.
Thank you very much for having me, and I hope that once we have the results, we can circle back about the future of emollient therapy in preterm infants.
After analyzing and researching this intervention, we hope that emollient therapy will be widely used beyond least developed countries, as it is cost efficient and there are many proven benefits shown in preterm infants. We believe that emollient therapy with Aquaphor and sunflower seed oil should be implemented in hospital protocols around the world, including in the US. With our podcast guest, we were able to gather information about Dr. Diaz's perspective, as she is in the front line of a similar case study with infant massage at the UMD Medical Center. Through our discussion and hearing from her perspective, we learned how effective this type of therapy can be in treating preterm infants. We were impressed with the power of emollient therapy and are excited to continue seeing it implemented in many more hospitals.